guys. Out, I'm enjoying the sun. It's like warm out right now. Really lucky to live where I live. It's like 70, I think. Anyway, so I want to talk about mental health and addiction. So as you full well know, I am a Kratom advocate and consumer for over 3 years. And I definitely want to push the fact that Kratom is an awesome tool to help with anxiety, depression, chronic pain, PTSD, so many things. I mean, it can help with weight loss. You gotta be responsible though when you take this. That means, you never want to depend or rely on something as a means of escape. So, the mind is a tricky thing. We can tell ourselves lies or just ignore our truth or just, avoidance. That's a strong behavior. There's just so many factors that come into play, but, as an adult, it's important to take inventory of, why you are taking something, like what you're taking it for. Like, do you have a legitimate reason? What's the reason? Because if you do have addiction issues, and, only you know that deep inside, that's very personal. If you have suffered like a lot of trauma in your life, like some people, everyone's different. I've suffered a lot of trauma in my life. And it started when I was an adolescent, when I was very young. It started when I was like 12 years old. Actually 11. It started when I was 11 years old. And, it was sexual assault and that kind of thing. And then, just being around drugs and alcohol. I'm tired of being silent. I'm tired of being silent in order to protect the people who violated me or abused me or took advantage, or just were scummy, had issues of their own, and, they brought it around me as a young child. No, I'm not going to name names, but I'm not going to be as silent about what has happened in my life and the amount of people I have lost due to addiction. It's crazy. It's just, I tried to count the amount of people who I've lost to, death as a result of addiction, or just their health is deteriorating, or relationships are destroyed, because of alcohol and or drugs. And so far I've counted 11, but I know that number is higher. I mean, that's significant in itself. But the first time I snorted a line, I think I was like 12 years old. Like that. That's crazy. It makes me mad because just so many things have happened to me that were beyond my control, and it molded, it messed up my life for a good part of my life. Was not completely destroyed or anything, but it's really, it affected me, and it took me longer to become who I was meant to be. So, I lost some life due to these other people in my life when I was a child, doing X, Y, and Z. But, I got drunk and stoned for the first time when I was in 6th grade. That's not good. But still, I rose above, and I gotta give myself credit because I'm so strong. And most people probably in my shoes, if they had gone through what I went through, and if they were exposed to so much drugs and alcohol and just bad environment at such an early age, they probably would be in jail or dead, or a severe alcoholic or drug, or really abusing and dependent on drugs. And I'm none of those things. So I'm really, really proud of myself. And, I deserve to get credit for that. And if anything, I'm just so hard on myself, for no legitimate reason. But anyway, so, one of my points of this is that, when I'm addressing in my blog, southeastbeautiful.com, is that, I believe addiction is a symptom. It is a behavior and a symptom of what's underlying. And so I wish more doctors and psychiatrists, and I wish that they were more aware of that fact. I just don't get it. It's, I almost wonder if it's like a trickling down from our government, like how we are taught, how our medical professionals are trained and taught in school. Almost makes me think that that's their doing. It just feels like they don't want us to really get better. I know, there are some folks who are, I believe that maybe they do have a disease that's addiction, and it's organic, and they're predisposed because it is hereditary, but I don't believe that for everyone. And also, people, I just wish we got to talk about what really is the root of the problem. And I don't believe that addiction, or I don't believe in labeling people addicts. I just hate that term, and it's so stigmatizing. It carries so much shame for the person. That is one reason as to why people can't stop abusing drugs and alcohol, I believe, because they're already shamed. They already feel bad about themselves because they got it in their brains. Oh, they're an addict, they're an alcoholic, look at, you go to AA. Well, I've never been to an AA meeting. A little bit, not on the other side of things as a mental health professional, but I've seen what goes on. The first thing that you have to do is admit to yourself, hi, my name is I'm an alcoholic. I'm sorry, I don't see how that is constructive. I see, okay, you have to admit so you can fix the problem, but I just think it's a bad approach. I don't believe in that. And I think it's really bad that they, make everyone label themselves like that. I think it's just it's to a bad degree. It shouldn't be to that extent. I think that if someone is abusing a substance and they're self-medicating, I think that they should go to psychotherapy or, get some kind of counseling, and then maybe later go to meetings or whatever. I think that's a great support system, but not as the main resource. I think therapy is crucial. Sorry, it's a little loud here, kind of next to the freeway, but so I just feel like we have to start talking about, and we as human beings, we can learn from each other, but the only way we're going to learn from each other is if we're honest and we talk about the truth of what's going on. It's true, we're as sick as our secrets. It's so true. And like, I don't think it's good. Like, I understand how, when a loved one dies and say they died of a drug overdose or alcohol poisoning or something that, again, it's shameful. See, nobody wants to admit it, or they don't want to say what really happened, how their loved one died, because they don't want the person to look bad. They just want them, they want them to like be remembered in a good light. Well, I'm not sure I agree with that, because how are we going to get past the stigma if we're so ashamed to talk about it? We have to be honest and truthful about what happened to that person, because otherwise, if we hide it, how are we ever going to learn? How are we going to learn from that person's mistake? Like, it just makes my blood boil. I mean, I just found out last night that a loved one of mine, she died of her heart. Her heart finally gave out. And I mean, I knew her. I used to take care of her when she was a little girl. And it's so sad. She grew up around drugs. Her parents were both, they smoked crank. They were really addicted to methamphetamines and just a bad environment. And anyways, my point is that she, her heart finally gave out, and she was only like in her 30s. But yet, they don't talk about it. They just said, oh, we're not sure what happened. Well, I mean, I do know what happened. And just like I have someone else in my life that, something happened to him like that. He was, he's abused. He's done crank almost, for years and years and years and years. And finally, like, we all know what crank does to your heart. It makes your heart race. And I mean, if you do that every day, if you do that for just years and years, of course it makes sense that would be hard on your heart, and it wears your heart out. And so, I mean, the doctor told him that if he didn't stop, that like in a year he would need a heart transplant. And at that time, I think he was just like a few years older than I am. So I think he was like maybe like 40 or something. So, these are the things that I feel like we need to discuss. And, mental health and drug addiction, it all carries so much shame, and we have to stop that. I mean, part of the problem is our government and the doctors and the healthcare professionals. That was one of the most frustrating things for me as an LVN and psych tech when I worked at St. Helena acute psych facility, and dealing with people who would come in, and I'd strip search them, and they had drugs on, whatever, they had addiction issues. But see, I was always like on the patient side. I didn't like the fact like how they just condemned, people. Like, we have to treat our people better than what we're treating them. We shouldn't be labeling them addicts. Like, what is that? That doesn't even make any sense. An addict? What is that? No, if you're addicted to something, it's because you have an underlying issue. You're in pain. There's a reason why. Some people have said, oh no, it's just because it feels good. No, for the most part, usually if you haven't had any real trauma, and usually it's not the case. I mean, I could see maybe, once in a while, like doing it just to party or whatever, but if you have a real problem and you're like trying to escape, well, if you're escaping because you want that feeling, because you don't like the feeling that you have without it, that usually means that you're trying to escape what's really going on inside of you. And some people have had trauma that they block out. We're all different. Not everyone remembers their trauma or their childhood, and so that makes it a little harder, a little trickier. But really, there are reasons. It's not like, oh no, these people just want to get high and they just want to do drugs because it feels good and they have a substance abuse problem. Nope, no. That's just like scratching the surface. We have to get down to the root of the problem, the issue, and nobody's doing that. Our mental health system is a joke. I mean, to this day, they still tell people that they have a dual diagnosis. If they have addiction issues and they're depressed or have anxiety, that's mind-baffling to me. I'm not saying that every person is the same. And yes, maybe there are real diagnoses like that people have since early childhood. Maybe they had mental health issues, and then maybe that drove them to do drugs later. That's a little different. I could see, and then maybe addiction ran in their families also. So maybe something could develop organically, and I could see that could be a dual diagnosis. However, I don't really see that for the most part. I mean, there are a lot of people out there who suffer with anxiety, depression, and it's tough. It's hard, or they had trauma, and again, they're self-medicating, and a lot of those folks didn't have addiction that runs in their families, so that wouldn't be organic. And it's just, there's so many variables, but the bottom line and my point is that it needs to be addressed mentally and emotionally. Don't just go to AA or whatever. I mean, I'm not downing these programs. These programs, help people, but for a lot of people, they don't help. And yes, relapsing is that is part of the process. So don't beat yourself up. But there's a difference if someone is just going and going and it's not working. And again, I mean, you have to address your mental health. I mean, it can't hurt, I mean, even, go make an appointment. If you're not wanting to have psychotropics be pushed upon you, which I understand, because I'm not completely pro psychotropics always. So seek out licensed social worker, because that is beyond their scope of practice. They cannot prescribe medication, but they can definitely help you work out your trauma. So okay, it's loud here. So I'm gonna end this for now. But check out my articles on southeastbeautiful.com. And again, Kratom is an amazing tool that can be utilized, and it's definitely even better when utilized in conjunction with therapy, because you never want to rely on anything in life as a means to escape, or avoid something that is underlying. You just got to deal with it. You got to deal with it. And remember, instead of don't listen to, it just makes me sad because society carries so much stigma. They tell you, they make you feel like, okay, you're an addict, or you're an alcoholic, or you're a shopaholic, or you're fat, or you're thin, or oh, she's mental, or what. I mean, it's bad. It's just so negative, and we are not our symptoms. Addiction is a symptom of what is underlying. It is a behavior. We are not a symptom. Same with chronic pain. Same with, being diagnosed, or, having a condition that never goes away and it's permanent. It's taken me a long time to accept this, but it's true. We are not our illness. We are not illnesses. We are not symptoms. We are human beings who have experiences, thoughts, and symptoms. And that's it. But we are not the symptom. And we are not the illness. I love you guys. Okay. Bye.